While aging and loud surroundings are the leading cause of hearing loss, you might be surprised to learn that obesity and smoking can also have an impact. In a study published in the Journal of the Association for Research into Otolaryngology, researchers analyzed 4,000 people aged 53 to 67 and found that smoking and one's body mass index could restrict blood flow to the ear, causing an increased loss of hearing. Paige Holt, Doctor of Audiology at Lake ENT, explains some of the more common factors that can lead to hearing loss.
There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure. Men who work in a factory around loud equipment, women can work around loud equipment as well. Family history can play a part, genetics, but we also can see some ototoxicity with certain medications that you take and certain drugs that are taken. Some of them are needed for life-threatening situations, and in those cases the physician who is administering that medication will refer the patient for monitoring to monitor the hearing over time as they take that medication to make sure that they're not losing a lot of the hearing. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, that you do start having your hearing screened in your middle years, because we want to know what your hearing is, a baseline, so that if you do have something happen and you start feeling like you're not hearing very well, my ear feels plugged up, I have some fullness in my ear, I have some ringing in my ear, then we can have a hearing test performed and we will have a baseline to compare it to.
The audiology and hearing aid team at Lake ENT includes medical doctors, doctors of audiology, licensed hearing aid specialists, among others, to help best diagnose the source of your hearing loss. For more information on the treatment options available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, follow the Factors in Hearing Loss StoryLink icon on our homepage, yourhometownhealth.com.